Good day, everyone. Welcome to our Nloa 2 long test 1 rationalization. I'm actually in charge of three aspects. We have care of adult clients with gastrointestinal alteration or disorders. And at the same time, I'm also in charge of discussing the answers for the care of adult clients with genitourinary alterations or disorders. Then finally, I'm actually in charge of discussing the answers for care of adult clients with integumentary alterations or disorder. Let's begin with question number 1. A nurse is caring for a patient who is scheduled for colonoscopy and whose bowel preparation will include poly- polyethylene glycol electrolyte lavage prior to the procedure. The presence of what health problem would contraindicate the use of this form of bowel preparation? A. Inflammatory bowel disease. B. Intestinal polyps. C. Diverticulitis. Or D. Colon cancer. So in this case, the best answer is letter A, which is inflammatory bowel disease, because the use of a lavage solution is contraindicated in this patient with intestinal obstruction or inflammatory bowel disease, and it can be safely given or with patients who have polyps, colon cancer, or diverticulitis, because when they say inflammatory bowel disease, there is a possibility of perforation. Answer for number 1 is letter A. Let's proceed to question number 2. A nurse is promoting increased protein intake to enhance a protein patient's wound healing. The nurse knows that enzymes are essential in the digestion of nutrients such as protein. What is the enzyme that initiates the digestion of protein? A. Pepsin. B. Intrinsic factor. C. Lipase. Or D. Amylase. Of course, the enzyme that initiates the digestion of protein is pepsin. The correct answer for number 2 is letter A. We know that intrinsic factor is actually a combination with vitamin B12 for absorption by the ileum or part of the intestine, and lipase aids in the digestion of fat, and amylase aid in the digestion of starch or the glucose or the carbohydrate. Best answer for number 2 is letter A. Number 3. A nurse is preparing to place a patient to ordered nasogastric tube. How should a nurse best determine the correct length of the nasogastric tube? A. Place Place distance distal tip to nose, then ear tip and end of xiphoid process. B. Instruct the patient to lie prone and measure tip of nose to umbilical area. Or D. Insert the tube into the patient's nose until secretions can be aspirated. Or D. Obtain an order from the physician for the length of the tube to insert. Of course, our mnemonic for this one is next, which is basically the tip of the nose, the tip of the earlobe, and of course, X is the xiphoid process. Number 3, the best answer is letter A. So the tube length is traditionally determined by measuring the distance from the tip of the nose to the earlobe and from the earlobe to the xiphoid process. And you can actually add 6 inches for NG placement for at least 8 to 10 inches for more for intestinal placement. Although studies do not necessarily confirm that this is a reliable technique, the physician should not prescribe the specific length, and the umbilicus is not a landmark for this process. Length is not determined by aspirating from the tube. So the answer is A. Next. Number 4. A patient is concerned about leakage of gastric contents out of the gastric sump tube the nurse has just inserted. What would the nurse do to prevent reflux gastric contents from coming through the blue vent of a gastric sump tube? A. Prime the tubing with 20 ml of normal saline. B. Keep the vent lumen above the patient's waist. Or D. Maintain the patient in high phallus position. Or D. Have the patient pin the tube to their thigh. Of course, the blue lumen should be kept above the patient's waist to prevent reflux of gastric contents through it. Otherwise, it acts as a siphon. So the best answer for number 4 is letter B. So a one-way anti-reflux valve seated in the blue pigtail can prevent the reflux of gastric contents out of the vent lumen. And in order to prevent the reflux, the nurse does not prime the tubing and maintain the patient in high phallus position, or have the patient pin the tube to the thigh. So number 4, the best answer is letter B. Let's proceed to question number 5. A nurse is providing oral care to a patient who is comatose. What action best addresses the patient's risk of tooth decay and plaque accumulation? A. Irrigating the mouth using a syringe filled with a bactericidal mouthwash. B. applying a water-soluble gel to the teeth and gums. B. Wiping the teeth and gums clean with a gauze pad. Or D. Brushing the patient's teeth with a toothbrush and small amount of toothpaste. Of course, the application of mechanical friction is the most effective way to cleanse the patient's mouth. The best answer for number 5 is letter D. So if the patient is able to brush the teeth, the nurse may brush them, taking precautions to prevent aspiration. Or as a substitute, the nurse can achieve mechanical friction by wiping the teeth with a gauze pad. Bactericidal mouthwash does not reduce plaque causing bacteria. However, it is not effective as application of mechanical friction. And the application of water sample gel may be applied to lubricate the dry lips, but it's not part of the oral care. Number 5, the answer is letter D. 6. An elderly patient comes to the emergency department complaining of an earache. The patient and has an oral temperature of 100.2 degree Fahrenheit. An otoscope assessment of the ear reveals a purely gray tympanic membrane with no evidence of discharge or inflammation. Which action should a triage nurse take first? A. Palpate the patient's parotid glands to detect swelling and tenderness. B. Assess the temporomandibular joint for evidence of malocclusion. C. Test the integrity of the cranial nerve 12 by asking the patient to protrude the tongue. Or D. Inspect the patient's gums for bleeding and hyperpigmentation. So for older adults and debilitated patients or any age who are dehydrated or taking medications that reduce saliva production are at risk for parotitis. So in this case, the best answer for number 6 is letter A. Symptoms include fever and tenderness as well as swelling of the parotid glands. Pain radiates to the ear, and pain associated with malocclusion is of of the temporomandibular joint may also radiate to the ears. However, temperature elevation would not be associated with malocclusion. The 12th cranial nerve is not associated with the auditory system, and bleeding and hyperpigmented gums may be caused by pyorrhea or gingivitis. These conditions do not cause the earache. Fever would not be present unless the teeth were actually abscessed. So answer for number 6 is letter A. 7. A nurse is caring for a patient who is just have diagnosed with peptic ulcer disease and teaching the patient about his new diagnosis. How should a nurse best describe a peptic ulcer? A. Inflammation of the lining of the stomach. B. Erosion of the lining of the stomach or intestine. B. Bleeding from the mucosa in the stomach. Or D. Viral invasion of the stomach wall. Of course, a peptic ulcer disease is considered to be the erosion of the lining of the stomach or the intestine. So the best answer for number 7 is letter B. Peptic ulcers are often accompanied by bleeding and inflammation, but these are not the definitive characteristics. The answer for number 7 is letter B. Erosion of the lining of the stomach or intestine, not the inflammation of the lining, not the bleeding, and not also viral invasion. Number 7, letter B. 8. A patient comes to the clinic complaining of pain in the epigastric region. What assessment question during the health interview would most help the nurse determine if the patient has a peptic ulcer? A. Does your pain resolve when you have something to eat? B. Do over the counter pain medication helps you pain? Or C. Does your pain gets worse if you get up and do some exercise? Or D. Do you find that your pain is worse when you need to have a bowel movement? Of course, the answer here is letter A. Pain relief after eating is associated with duodenal ulcers. The pain of peptic ulcer is generally unrelated to activity or bowel function and may or may not respond to analgesia. Number 8 is letter A. 9. The nurse is working on a patient who has a chronic constipation. What should be included in patient teaching to promote normal bowel function? A. Use of glycerin suppositories on a regular basis. B. Limit physical activity in order to promote bowel peristalsis. C. Consume high residue, high fiber food. Or D. Resist the urge to defecate until the urge becomes intense. The best answer for number 9 is letter C. Consume high residue, high fiber foods. Of course, goals for patients including restoring or maintaining a regular pattern of elimination by responding to the urge to defecate, ensuring adequate intake of fluids and high fiber foods. learning about methods to avoid constipation, and relieving anxiety about bowel elimination patterns and avoiding complications. Letter A is wrong because it's actually going to be use of medications. Ongoing use of pharmacologic aids should not be promoted due to the risk of dependence, and increased mobility helps to maintain a regular pattern of elimination, and the urge certificate should be heeded. Number 9, letter C. 10. A nurse is preparing to provide care for a patient whose exacerbation of ulcerative colitis has required hospital admission. During an exacerbation of his health problem, the nurse would anticipate that the patient's stool will have what characteristics? A. Watery with blood and mucus. B. Hard and black or tarry. C. Dry and streaked with blood. Or D. Loose with visible fatty streaks. Of course, the predominant symptoms of ulcerative colitis are considered to be diarrhea. So therefore, the answer here is letter A. Letter B, that is fecal impaction, and dry and streaked with blood, that is fecal impaction. Loose with visible fatty streak. It shouldn't be fat, but it should be mucus. So stools may be bloody and contain mucus. Stools are not hard. It should not be dry. It should also not be tarry or black, or fatty patients who have ulcerative colitis. Number 10, the answer is letter A. 11. Which statement by the nurse is most likely to help a morbidly obese 22-year-old man in losing weight on a 1,000 calorie diet? It will be necessary to change lifestyle habits permanently to maintain weight loss. B. You will decrease your risk for future health problems such as diabetes by losing weight now. C. You are likely to notice changes in how you feel with just a few weeks of diet and exercise. Or D. Most of the weight that you lose during the first week of dieting is water weight rather than fat. The answer for number 11 is letter C. So motivation is a key factor in a successful weight loss, and a short-term outcome provides a higher motivation. So for a 22-year-old patient is unlikely to be motivated by future health problems. Telling a patient that the initial weight loss is water will be discouraging, although this may be correct. Changing lifestyle habits is necessary, but this process occurs over time, and discussing this is not likely to motivate the patient. 11. The answer is letter C. 12. After the nurse teaches a patient about the recommended amounts of foods from animal and plant sources, which menu selections indicate that the initial instructions about diet have been understood? A. 3 ounce of lean meat, 2 ounce of low fat, cheese, and a tomato slice. A B. 3 ounce of roasted pork, a cup of corn, and A. Cup of carrot sticks. C. Cup of toast, salad, and unfat dressing, topped with a chicken breast. Or D. Half cup of tuna mixed with non-fat mayonnaise and half cup of a celery. So the best answer here is letter B. This is considered to be a selection which is most consistent with a recommendation of the American Institute of Cancer Research that one-third of the diet should be from animal sources and two-thirds from plant-source foods. The other options have higher ratios of animal origin foods to plant-source foods that would be recommended. So number 12, the best answer is letter B. Let's proceed now to the second part, which is actually on care of adult clients with genitourinary alterations or disorders. 13. The care team is considering the use of dialysis in a patient whose renal function is progressively declining. Renal replacement therapy is indicated in each of the following situations: A. When the patient's creatinine level drops below 1.2 milligram per deciliter. When the patient's blood urine nitrogen is above 15 milligrams per deciliter. C. When approximately 40% of nephrons are not functioning. Or D. When about 80% of nephrons are no longer functioning. Of course, there is a need for continuous renal replacement therapy for a patient having 80% of the nephrons that are no longer functioning. So when the total number of functioning nephrons is less than 20%, continuous renal replacement therapy needs to be considered, and dialysis is an example of a renal replacement therapy. Then, prior to the loss of about 80% of the nephron functioning ability, the patient may have mild symptoms of compromised renal function, but symptom management is often obtained through dietary modifications and drug therapy. The listed creatinine and BUN levels are within the reference levels or normal values. 13, the best answer is D. 14. A nurse knows that specific areas in the uterus have a propensity for obstruction. Prompt management of renal calculi is most important when the stone is located where? A. In the ureteropelvic junction. B. In the ureteral segment near the sacroiliac junction. Or C. In the ureterovesical junction. Or D. In the urethra. Best answer for number 14 is letter A. So the three narrowed areas of each ureter are the ureteropelvic junction, the urethral segment near the sacroiliac junction, and the uretero-vesical junction. These three areas of the ureters have a propensity for obstruction by renal calculi or stricture. Obstruction of the uretropelvic junction is most serious because of its proximity to the kidney and the risk of associated kidney dysfunction. The urethra is not part of the ureter. So D is eliminated. Best answer is A. It's the most. The other is the least. 14, letter A. Let's now have question number 15. The nurse is assessing a patient suspected of having developed acute glomerulonephritis. The nurse should expect to address what clinical manifestations that is characteristic of this problem. A. Hematuria. B. Precipitous decrease in serum creatinine levels. B. Hypotension unresolved by fluid administration. D. Glucosuria. Of course, the primary presenting feature of acute glomerulonephritis is the presence of hematuria, or there's presence of blood in the urine, which may be microscopic, and that can be identifiable through a microscopic examination. And it can also be macroscopic or gross or visible to the eye. There will also be presence of proteinuria. Primarily, albumin, which is present, is due to increasing permeability of the glomerular membrane, and the BUN level and serum creatinine levels may rise as urine output drops, and some degree of edema and hypertension is noted in most patients. So letter A is the best answer. 15 is letter A. 16. The nurse is caring for acutely ill patient with assessment finding should prompt the nurse to inform the physician that the patient may be exhibiting signs of acute kidney injury or AKI. A. The patient the patient complains of an inability to initiate voiding. B. The patient urine is cloudy with a foul odor. Letter C. The patient's average urine output has been less than 10 ml for several hours. Or D. The patient complains of acute flank pain. Of course, when there is oliguria or less than 500 ml of urine, 24 hours is the most common clinical manifestation seen in patients with AKI. And if there is presence of flank pain, that is and the inability to initiate voiding are not characteristics of AKI, but it could possibly be for urinary tract infection. And cloudy foul smelling urine is suggestive of a UTI as well. So number 16, the best answer is letter C. 17. A patient, a female patient has been experiencing recurrent urinary tract infections. What health education should a nurse provide to this client? A. Bathe daily and keep the perineal region clean. B. Voiding immediately after sexual intercourse. C. Drink liberal amount of fluids. D. Void at least every 6 to 8 hours. Of course, the patient is encouraged to drink liberal amount of fluids. Water is the best choice to increase urine production and flow, which flushes the bacteria from the urinary tract. So frequently voiding every 2 to 3 hours is encouraged, not every 6 hours, to empty the bladder completely because this can significantly lower urine bacterial counts, reduce urinary stasis, and prevent reinfection. The patient should be encouraged to shower rather than bathe. Answer for number 17 is letter C. 18. A 42-year-old woman comes to the clinic complaining of occasional urinary incontinence when she sneezes. The clinic nurse should recognize what type of incontinence: A. Stress incontinence, B. Reflex incontinence, D. Overflow incontinence, or C. Overflow incontinence, or D. Functional incontinence. Of course, the answer here is letter A. Stress incontinence is the involuntary loss of urine through an intact urethra as a result of sudden increase in the intra-abdominal pressure. On the other hand, reflex incontinence is loss of urine due to hyperreflexia or involuntary urethral relaxation in the absence of normal sensations, usually associated with voiding. And overflow incontinence is the involuntary urine loss associated with overdistension of the bladder. Then functional incontinence refers to those instances in which the function of the urinary tract is intact, but others may it difficult or impossible for the patient to reach a toilet in time of voiding. 18, the answer is alpha. 19. A school nurse is presenting information on human development and sexuality, which describing the role of hormones in sexual development. Which hormone does a nurse teach a class is the most important one for developing and maintaining the female reproductive organs? A. Estrogen, B. Progesterone, D. Androgens, or D. Follicle stimulating hormone? Of course, the answer here is letter A, because we know that estrogen is responsible for developing and maintaining the female reproductive organs. And when you say progesterone, is the most important hormone for conditioning the endometrium in preparation for implantation of the fertilized ovum. Then the androgens secreted by ovaries in small amounts are involved in the early development of the follicle and affect the female libido. On the other hand, follicle stimulating hormone is responsible for for stimulating the ovaries to secrete estrogen. Answer alpha. 20. The nurse is taking the sexual history of an adolescent who has come into the clinic. What question best assesses the patient's need for further information? A. Are you involved in an intimate relationship at this time? C. How many sexual partners have you had? C. What questions or concerns do you have about your sexual health? Or letter D. Have you been diagnosed with sexually transmitted infection? Of course, it should be that an open-ended question are going to be included in the interview. So an open-ended question related to the patient's need for further information should be included while obtaining a sexual history, and none of the other listed questions are open-ended. Over letter C. Answer for number 20, letter C. 21. While taking a health history on a 20-year-old female client, the nurse ascertains that this patient is taking meconazole or monistat. The nurse is justified in presuming that the patient has what condition? A. Bacterial vaginosis, B. HPV or human papillomavirus, or C. Candidiasis, or D. Toxic shock syndrome. Of course, candidiasis is a fungal infection or yeast infection caused by strains of Candida, and conazole is an antifungal medication used in the treatment of candidiasis. This agent is inserted in the vagina with an applicator at bedtime and may be applied to the vulval area for pruritus. Vaginal vaginosis, HPV, and toxic shock syndrome is not treated by Monistat. Answer C. 22. A patient with genital herpes is having an acute exacerbation. What medication would a nurse expect to be ordered to suppress the symptoms and shorten the course of the infection? A. Clotrimazole, B. Metronidazole, D. Podophyllin, or C. Podophyllin, or D. Acyclovir. Of course, the answer here is letter D, because uh, genital herpes is actually a viral infection. So acyclovir is an antiviral agent that causes suppression that can suppress the symptoms of genital herpes and shorten the course of the infection. It is considered to be effective in reducing the duration of lesions and preventing recurrences. So the cotrimazole is used in the treatment of these infections. Metronidazole is the most effective treatment for trichomoniasis, and pseudopoxypilline is used to treat external genital warts. And acyclovir is used for the genital herpes. That is 22, the best answer D. 23. A 45-year-old woman comes into the health clinic for her annual checkup. She mentions to the nurse that she has noticed dimpling of the right breast that has occurred in few months. What assessment would be appropriate for the nurse to make? A. Evaluate the patient's milk production, palpate area for breast mass, assess the patient's knowledge of breast cancer, or assure the patient that this likely are age-related change. So in this question, it would be most important for the nurse to palpate and assess the breast to determine the presence of a mass and to refer the patient to her primary care provider. Edema and pitting of the skin may result from neoplasm blockage of the lymphatic drainage and giving the skin an orange peel appearance or pudorang, and the classic sign of advanced breast cancer. Evaluation of milk production is required in lactating women, and there's no indication of lactation in the scenario. The patient's knowledge of breast cancer is relevant, but it's not a time dependent priority. The finding is not an age related change. 23. The answer is Bravo. 24. The nurse leading an educational session is describing examination of the breast. The nurse tells the women's group to raise their arms and inspect their breast in a mirror. A member of the women's group asks the nurse why raising her arms is necessary. What is the nurse's best response? It helps to spread out the fat that makes up your breast. It allows you to simultaneously assess for pain. It will help to observe for dimpling more closely. And this is what the American Cancer Society recommends. The answer for number 24 is letter C. The primary reason for raising the arms is to detect any dimpling, and in order to elicit dimpling or retraction that may otherwise go undetected, the examiner instructs the patient to raise both arms overhead. And citing the American Cancer Society recommendations does not address the woman's question. The purpose of raising the arm is not to elicit pain or to redistribute adipose tissue. Answer Charlie. 25. An adolescent that is identified as having a collection of fluid in the tunica vaginalis of his testes. The nurse knows that this adolescent will receive what medical diagnosis: A. Cryptorchidism, B. Architis, C. Hydrocele, or D. Prostatism. Of course, an hydrocele refers to the collection of fluid in the tunica vaginalis of the testes. And of course, we know that cryptorchidism is the most common congenital defect in males, characterized by failure of one or both testes to descend into the scrotum. And then architis is an inflammation of the testes, or there is presence of testicular congestion caused by pyogenic, viral, spirochetal, parasitic, traumatic, chemical, or unknown factors. On the other hand, prostatism is an obstruction and irritative symptom complex that includes increased frequency and hesitancy in starting urination, a decrease in the volume and force of the urinary stream, acute urinary tract infection, and there's recurrent urinary tract infections. So that's the end for the second part. Let's proceed now to the third part on the care of adult clients with integumentary alterations or disorder. Question number 26. A nurse is aware that the outer layer of the skin consists of dead cells that contain large amounts of keratin. The physiologic function of keratin includes the following: A 1. Producing antibodies, B. Absorbing electrolytes, C. Maintaining acid base balance, D. Physically repelling pathogens, or D. Preventing fluid loss. Of course, the dead cells of the epidermis contain large amounts of keratin, an insoluble fibrous protein that forms the outer barrier of the skin. The keratin has the capacity to repel pathogens and prevent excessive fluid loss from the body. It does not contribute directly to antibody production, acid base balance, or electrolyte levels. The answer for number 26 is C, 4 and 5 only. 27. When planning the skin care of client with decreased mobility, the nurse is aware of varying thickness of epidermis. At what location is the epidermal layer thickest? A. The scalp, the elbow, the palms of the hands, and the knees. The answer is the palms of the hands. The epidermis is the thickest over palms of the hands and the soles of the feet because of the uh, most commonly used area. 27. Letter C. 28. A young student is brought to the school nurse after falling off a swing. The nurse is documenting that the child has bruising on the lateral aspect of the right arm. What term will the nurse use to describe bruising on the skin in documentation? A. Telangiasis, B. Ecchymosis, C. Purpura, or D. Urticaria. Of course, we know that telangiasis consists of red marks on the skin caused by stretching of superficial blood vessels, and that ecchymosis are bruises. Purpura consists of pinpoint hemorrhages of the skin, and urticaria wheals or hives. So when we talk about the description, the best answer is letter B, ecchymosis. 29. The nurse in ambulatory care center is admitting an adult patient who has bright red moles on the skin. Benign changes in benign changes in the early skin that appear as bright and red moles are termed what? A. Cherry angiomas, B. Solar in lentigo, C. Seborrheic keratosis, or D. Xanthillasma. The best answer is letter A, because cherry angiomas appear as bright red moles, while molar lentigo are commonly called liver spots, and seborrheic keratosis are described as crusty brown stalk on patches, while xanthelasma appears as yellowish, waxy deposits on the upper eyelids. 29. The answer is letter A. 30. A nurse practitioner is seeing a 16-year-old male patient who has come to the dermatology clinic for treatment of acne. The nurse practitioner would know what the treatment may consist of. Which of the following medications? Acyclovir, B. Benzoyl peroxide and erythromycin, D. Diphenhydramine, or D. Triamcinolone. Of course, we know that benzam, benzamycin gel is among the topical treatment available for acne. And Sovirax is used in treatment of herpes zoster is as an oral antiviral agent, and Benadryl is an antihistamine used in treatment of arthritis, and trilateral injections of Kinolog has been utilized in the treatment of psoriasis. 30. The answer is Bravo. 31. A patient is caring for a patient has been diagnosed with psoriasis. The nurse is creating an educational plan for a patient. What information should be included in this plan? A. Use caution when taking non-prescription medication. B. Avoid public places until symptoms subside. C. Wash skin frequently to prevent infection. Or D. Liberal apply corticosteroids as needed. The answer is A. The patient should be cautioned about taking non-prescription medications because some may aggravate mild psoriasis. Psoriasis is not contagious. Many patients need a reassurance that the condition is not infectious, not a reflection of poor hygiene, and not a skin cancer. There's excessive frequent washing of the skin produces more soreness and scaling. Overuse of topical corticosteroids can result in skin atrophy, tree, and medication resistance. 31 is letter A. 32. A nurse is planning the care of a patient with herpes zoster. What medication is, if administered within 21st 24 hours of initial eruption, can arrest herpes zoster? A. Prednisone, B. Azathioprine, D. Triamcinolone, or acyclovir. Of course, acyclovir, if started early, is effective significantly in reducing the pain and halting the progression of the disease. There is evidence that the infection is arrested if oral antiviral agents are administered within the first 24 hours. Prednisone, which is an immunosuppressive agent or anti-inflammatory agent used in a variety of skin disorders but not in treatment of herpes. Azathioprine is an immunosuppressive agent as well, used in treatment of pemphigus, and triamcinolone is utilized in treatment of psoriasis. 32. Delta. 33. A patient with squamous cell carcinoma has been scheduled for treatment of his malignancy. The nurse should anticipate the treatment for this type of cancer will primarily consist of what intervention? A. Chemotherapy, B. Radiation therapy, C. Surgical excision, or D. Biopsy of sample tissue. The answer is C. The primary goal of surgical management of squamous cell carcinoma is to remove the tumor entirely. Radiation therapy is reserved for older patients because X-ray changes may be seen after 5 to 10 years, and malignant changes in scars may be induced by radiation 15 to 30 years later. Obtaining a biopsy would not be a goal of treatment, it may be an assessment. Chemotherapy and radiation therapy are generally reserved for patients who are not surgical candidates. 34. A patient is brought to the emergency department from the site of a chemical fire where he suffered a burn that involves the dermis and the muscles and bone of the right arm. On inspection, the skin appears charred. Based on this assessment findings, what is the depth of the burn on the patient's arms? The answer is D, full thickness, because it already involves the muscles and the bones. A full thickness burn involves total destruction of the epidermis and the dermis, and in some cases, underlying tissue as well. When color ranges widely from white to red, brown, or black, and the burn area is painless because the nerves have been destroyed. The wound can appear leathery, hair follicles and sweat glands are destroyed, edema may be also present, and when you talk about superficial partial thickness burns, it involves the epidermis and possibly a portion of the dermis, and the patient will experience pain that is soothed by cooling. Deep partial thickness burns involves the epidermis, upper dermis, and portion of the deeper dermis. The patient will complain of pain and sensitivity to cold air. Full partial thickness is not in depth of burn. Answer is letter D. 35. The current phase of patient's treatment of burn injury prioritizes wound care, nutritional support, and prevention of complications such as infection. Based on these care priorities, the patient is in what phase of burn care: emergent, immediate resuscitative, acute, or rehabilitation. Of course, the acute or intermediate phase of burn care follows the emergent resuscitative phase and begins 48 to 72 hours after the burn injury. During this phase, attention is directed towards continued assessment and maintenance of respiratory and circulatory status, fluid and electrolyte balance, and gastrointestinal functions. And of course, the priorities during the rehabilitation phase includes prevention of scars and contractures, rehabilitation, functional and cosmetic reconstruction, and psychosocial counseling. The answer here is Charlie. 36. A patient in emergent resuscitative phase of burn injury has had blood work and arterial blood gases drawn. Upon analysis of the patient's laboratory studies, the nurse will expect the results to indicate, of course, the answer here is alpha. There is hyperkalemia that is related to release of potassium into the extracellular fluid, and there is hyponatremia, because large amounts of sodium loss in trapped edema fluid. There is presence of elevated hematocrit or hemoconcentration that leads to an increased hematocrit, and there is loss of bicarbonate ions that results in metabolic alkalosis. The answer for 36 is alpha, not hypokalemia. It's hyperkalemia, but not hypernatremia. It's hyperkalemia and hyponatremia. Answer for number 36 is alpha. Let's now have the last number. A patient has experienced an electrical burn and has developed thick scar over the burn site. Which of the following topical antibacterial agents would the nurse expect the physician to order for the wound? A. Silver sulfadiazine, water soluble cream. B. Muffinide acetate, hydrophilic base cream. Letter C. Silver nitrate, aqueous solution, or anti-coat. Of course, muffinate acetate 10% hydrophilic base cream is the agent of choice, and there is no need to penetrate their thick eschar. Silver nitrate is do not penetrate eschar, and anti-coat is type of silver dressing. The answer for number 37 is letter B. And that is it. Congratulations, everyone. See you again next time.